Hello and welcome to our FB Live, our first ever FB Live for Mahkota Medical Center, where today we will talk about what's your blood know that you don't and the signs of early cancer detection. A very warm welcome to everyone here. I think before even we start, I would like to know our audiences of where do you from? Do you mind to actually put in the comment below of where you are actually dialing in from? Which country? Ask this question. These are actually able to help our speakers to actually address your needs later. Just share where do you from. You could be from Malaysia, from Malacca, you could be from Kuala Lumpur, you could be from Seremban, Kuala Lumpur, or you could be from Indonesia. Let's get us to know where you are from. Oh, we have here from Malacca, Vicky. Yeah, Lim Ling from Malacca as well. Welcome. I believe that now people are just out from work. Hence, I think we can see like the live are actually keep increasing. People are dialing in. Yeah, we have Chun Ki from Kuala Lumpur. Hi, Chun Ki. Oh, we have Enlai from Kedah. Wow, okay. Let's see. Ahmad as well from Kuala Lumpur. Do you have anyone from Indonesia? Anyone from Singapore? Join us today. Oh, Iza from Malacca as well. I think let's keep this coming, because this live, although you may actually not able to join live session, but after the session, the live video will still be available in our Facebook channel, where you can continue benefit and forward it to your friends and family that you think they can actually benefit from this session. Yeah, we have, oh, someone, Zatu from Ampang Selangor. Welcome. I think without further ado, perhaps we should start to introduce our panelists. A very warm welcome to our panelists, Dr. Chong Kwanjit, which is clinical oncologist from Mahkota Medical Center, which has been having decades of experience as a clinical oncologist. Dr. Chong, would you mind to introduce yourself?
Myself, I'm a clinical oncologist. I've been working at Mahkota Medical Center for more than 20 years. I treat cancer basically.
Thank you. Definitely you are the subject matter expert for today, Dr. Chong. Besides that, we have also Dr. Ankush from Gene Solution Malaysia. Hi, Dr. Ankush.
Hi. So I'm Dr. Ankush. I'm the medical manager from Gene Solutions Malaysia.
Okay, without further ado, definitely everyone knows that cancer has been arising around the world, and we have actually the latest information on from the Lancet Oncology of where the cancer prevalence, incidences, and mortality. Can we have the slide, please? Yes. So, Dr. Chong, do you mind to actually walk us through what are the cancer incidence and the mortality, which is published in the Lancet, which is the gold standards in oncology, right? Which is published recently in April 2025.
Well, I can see that, Indonesia has the biggest incidence, obviously because in Southeast Asia, Indonesia has the biggest population, right? And then you look at it, followed by you have Vietnam, you have Thailand, and these are all countries with huge population. Yeah, Singapore, Cambodia, Laos, Brunei smaller. I think you can see that almost every country there are many people. There are many cancer. The cancer incidence is high, and mortality rate also is high. And countries with bigger population have more cancer. That's quite obvious. Yeah, that's all I would say.
Yeah, indeed, yes. So I think it has been raising concern of everyone, right? The detection of cancer late may due to more complication and mortality higher. So Dr. Chong, from a clinical oncologist perspective, why is it important to detect cancer earlier? And what would that make a difference if you're able to detect cancer earlier?
Well, I think if you look at it in a holistic way, I would say that there are 4 main strategies to treating cancer or to control cancer. Number 1 is, if possible, you want to prevent cancer from happening in the first place. If you are not able to prevent cancer, which means if one must get cancer, we want to detect the cancer as early as possible. That's strategy number 2. Strategy number 3 is, once the cancer is diagnosed, is detected, you want to give treatment promptly and appropriately. You have to give the right treatment basically quickly. Because there's no point you diagnose cancer at early stage and you do the wrong treatment. You go for alternative medicine, you miss the boat, you miss the chance. Of course, after treatment, the 4th or the last strategy is what we call rehabilitation. We want the patient to be back to normal, going back to play her previous role before she had cancer, or he or she had cancer. So the second strategy is early detection. Early detection is very important because if the cancer is diagnosed very late or diagnosed late, the outcome is not so good. Early detection, and prompt appropriate treatment not only saves lives, it also enhances good quality of life and also save a lot of sufferings, avoid a lot of sufferings. And finally, it also saves a lot of money if the cancer is treated early instead of late stage. Why did I say that early treatment, early detection and early treatment has better quality of life? Say for example, somebody with breast cancer. If the cancer is very early stage, the patient may only require a lumpectomy, removal of the lump. However, if the cancer is very big, perhaps the patient needs to sacrifice her whole breast. So the quality of life also is not as good. So early cancer saves lives. Early cancer has better quality of life. Early cancer reduces sufferings, and early cancer can save money. So early detection is very critical.
Wow, thank you very much, Dr. Chong, for a very comprehensive summary of why early detection of cancer is so important. Not only save your life, but also save cost, which is very key critical, right? Although we may have insurance, or some may not have, unfortunately, but early detection can make lots of difference for you, your family members, as well as for the doctors, clinical oncologists, for giving you even a more broader treatment or type of treatments. Yeah? Thank you very much, Dr. Chong. Very well said. So with that, let's come into a more deeper discussion of today, which is the science behind this blood test, which is multi-cancer early detection, which the question I would like to pose to Dr. Ankush, right, on what is ctDNA all about, right? It's something new to us, not genetic, but ctDNA. So let's Dr. Ankush to walk through with us what is ctDNA, what is multi-cancer early detection test all about. Dr. Ankush.
Thank you. Thanks, Gary. So, some of you may have heard about the multi-cancer early detection. So, rightly what Dr. Chong mentioned, the emphasis on the early detection of cancer cannot be ignored, right? It's very important for us to detect early cancer, if not prevent it. Now, whenever there is a tumor in our body, whenever there is a cancer in our body, the tendency of these cells is to shed DNA into the blood. You know that DNA is our genetic material, the material that actually controls all our features, whether it's physical, whether it's emotional, whether it's mental, all that information is coded inside our DNA. So the normal cells in our body tend to shed DNA in the blood. Likewise, if there is a tumor, it will also shed DNA into our blood. So, all these years, the early detection of cancer has been based on the imaging studies. So, you all must have heard of terms like ultrasound, mammography, CT scan, that basically use certain radiations or sound waves to detect whether there's any abnormal finding in your body. But now it is possible with a single blood draw. So let's say you go, for your annual health screening checkup wherein you take a blood sample. So here, as displayed on the screen right now, you can see that while taking this blood, we are able to also see that what is the quality of DNA that is present in the blood. So as the name suggests, ctDNA, it is the circulating tumor DNA. And if we can detect that your blood has any tumor DNA, basically we can screen you for multiple cancers via a single blood draw.
Yeah. What are the type of cancer that can be detected, Dr. Ankush?
So right now, our study has been empowered to detect for 10 types of cancer. So as you can see, what's displayed on the slide as well. Maybe we go to the next one. Yeah. So you can see that it can detect 10 types of cancer via a single needle to draw blood. So these are the common cancers: the breast cancer, lung cancer, colorectal, all your GIT, the stomach, liver, head and neck cancers, also related to women's health, endometrial and ovary cancer, and also some very aggressive cancers, that tend to spread very fast, like esophagus, like pancreas. Now, it's very important for these cancers to be detected early, because a lot of these cancers actually tend to be silent killers. So they don't present early. So the patient may not have symptoms today and then go to the doctor that, maybe I have certain symptoms, and then the patient will be tested for cancers. So that's why it's important to screen for these cancers, because these cancers may be silently lying in your body.
Okay, that's great. So, Dr. Ankush, maybe we can go to the previous two slides, which we know that this type of cancer, right, once detected, it need to combine with some other screening to actually confirm it. Do you mind to explain further?
Yes. So, like I mentioned, right, there are certain standard of care screening tools that are already in place, and these are recommended by guidelines and widely available across all countries, like the mammogram, colonoscopy, CT scan, ultrasound, and all. But these are very organ-specific tools that are used for cancer screening. So we say that if you want to go for a multi-cancer early detection test, yes, it is a screening test, okay? It is not a diagnostic test. It will not tell you for sure that you have cancer, but it is a screening tool that should be combined with the standard of care diagnostic screening tools that are already in place, and then it can provide the clinicians, your treating doctors, all the important information to go further.
Very well summarized, Dr. Ankush. So based on my understanding is, this BODMAS and multi-cancer early detection test is basically a test which you just have to draw blood, which is non-invasive. You don't need to go through any procedure, right? It's just a draw of blood, in which you don't need even fasting, right? Then from there, you can actually detect any tumor DNA in your current blood circulating in your body right now, which make it an early detection possible.
Yes.
Wow, such an innovative screening technology that we have right now, which we are very pleased that we have such technology to help everyone to detect cancer earlier, which perhaps, right, our ancestor or even our previous whoever have passed away away because of cancer may not have that opportunity to screen earlier that time. Yeah, thank you very much for sharing with us this latest technology. So with that, right, Dr. Ankush, who are actually eligible for this type of testing and who can be benefit from that? Can we go to the next slide?
Yeah. So as you can see now on the screen, actually the incidence of cancer has been rising, and what we have seen through various studies is that most of the cancers occur in people who are more than 40 years of age. So we want to screen everyone who is more than 40 years of age. So this test can be taken by any healthy individual who is more than 40 years of age. You may not have any signs, you may be completely fit, but you are still eligible to go for cancer screening through this test. Alright? Or if you have any risk factors, like if you've been smoking for a long time, if you're drinking alcohol, if you are having infection with hepatitis B or hepatitis C, if there is any family history, let's say your father, your mother, your aunt, your uncle had any cancer, or if you have tested yourself and you are carrying any inherited cancer mutations, then you are eligible to undergo these testing. However, we have to take caution also that this test should not be done on certain individuals. Individuals who have been diagnosed with cancer within the last 5 years should not undergo this testing. Individuals who have signs or symptoms that are highly suspected of cancer. Let's say you had some symptoms, you went to see your doctor and the doctor said, oh, I highly think that this may be cancer. Then don't go for this test. You need more specific tests for diagnosis now. Okay? Individuals who are pregnant should not undergo this test, and individuals who've had any blood transfusion, whole blood transfusion or bone marrow transplant in the last 3 months are also not eligible to undergo this testing. So in short, 40 years and above, healthy individuals are eligible to go for this testing, or if you have any of these listed risk factors here, please consider undergoing for the ctDNA testing for multi-cancer early detection.
Okay, I think this has been actually giving us a very clear indication who will benefit from this multi-cancer early detection test. So Dr. Chong, from your experiences, right, as a clinical oncologist, would you actually recommend like those currently patient that has been seeing you, their caregiver or family members, to go for this test?
You mean my cancer patients' family members?
Yeah.
Yes, certainly if they fit the criteria. But bear in mind that, like what Dr. Ankush mentioned just now, when we mention screening, we are referring to somebody that has no symptoms, the so-called normal screening. If the patient, if somebody is already having the symptoms or signs of cancer, then it's not screening. Then the person should go and see the doctor. Let's say somebody is having a lot of cough for the last 2 months and loss of weight. Every time he or she coughs out, there's a lot of blood. Maybe we worry about lung cancer. So we might go straight to do a CT scan of the chest rather than saying, oh, you do this blood test screening. Because screening is for somebody without symptoms, so-called normal, but high risk. Why is older people high risk? Because aging is a risk factor. Older people have higher risk of cancer. Actually, older people have got higher risk of many things: diabetes, hypertension, stroke, heart disease, dementia, etc. But old age is something you cannot avoid, right? But if you have other risk factors like heavy smoking, as Dr. Ankush mentioned, certainly yes, you can consider these tests. But then bear in mind that the standard of care is like what Dr. Ankush mentioned just now. We have, for example, a heavy smoker. The standard of care today is low dose CT scan of the chest. However, blood test, ctDNA test, is a very good, in my mind, supplementary or complementary test to the existing standard of care screening tests. May not be applicable to all, but certainly it is very useful, because this particular test by Gene Solution is able to detect 10 quite common cancers. And out of these 10 common cancers, only 3 of them has a standard of care screening test today. So the rest we don't have. So the rest of the cancers, for example, pancreatic cancer, ovarian cancer, very often when they first diagnosed, they are already in advanced stage. So as I mentioned earlier, treatment of advanced cancer, the outcome is not as good as treatment in early stage of the same cancer. Hence, if there's any test that can help us to detect the cancer at early stage and then treat early, obviously the outcome will be better. So we definitely want a test that can detect cancer at early stage. If a same test can detect multiple types of cancer, it's even better. Because when we talk about low-dose CT scan, we are talking about detecting lung cancer only. Whereas if we talk about colonoscopy, we are referring to the early detection of colorectal cancer only. Whereas if we have a test that can detect multiple cancers at early stage, that would be ideal.
Yeah, very well said, Dr. Chong. Definitely with a single draw of blood to test top 10 most cancerous or most aggressive cancer that along the Southeast Asia country is something that everyone should consider in terms of affordability, in terms of actually the cost of treatment, which I think thanks Mr. Hafiz Shami asked the question, what is it, the treatment, how much is the price? Now later we will actually reveal the price, how much for the top 10 cancer in terms of the detection. And I think maybe we shall actually address the question first, right? What is the term of detected? Is it classified as a cancer patient? That is a very good question. If you have this multi-cancer early detection, reports come out mentioning that you have actually a tumor DNA circulating in your DNA. Is it considered a cancer patient? Dr. Ankush, do you mind to take this question?
Yeah, sure. I think it's a very good question, because a lot of times when we see a positive report, we think like, okay, positive means like, okay, this is the cancer patient. But that is not the case, okay? Because we need to understand that this is not a test for diagnosis of cancer. Like Dr. Chong said, this is a test for screening only. So this test, if it is positive, it has to be complemented with the standard of care imaging. And even with that, if the imaging also comes out to be positive, it has to be followed up with further diagnostic tests like biopsy. So this is a screening test. This is not a diagnostic test. So let's say you do this test and your test report comes out to be positive, then your doctor will advise you to go for organ-specific imaging so that we can actually see that where is the cancer. So a positive report means that follow-up is required. Further action is required. Okay.
Thank you very much. This is very clear, Dr. Ankush. For the audience who actually dialing in, please continue to ask your question. We will try our best effort to answer your question. And indeed, right, we do not have much time. Later on, perhaps after the live, we can actually get the question answered as well from Dr. Ankush and Dr. Chong. So let us continue with the Q&A. Maybe we can change to next slide, which will address Mr. Hafiz's questions. Another slide. Yeah. So these are basically the multi-cancer early detection blood test, which is available in Makota Medical Center Facebook, which indicating, right, for the top 10 cancer, right, the test is actually at 1,755, which enable you to test the top 10 cancer with the tumor DNA. So what does it mean is, with like per cancer testing is about 100 ringgit, 75 ringgit, 175 ringgit, right? Which is, I think, like what Dr. Chong mentioned, is something that with a single drop of blood that allowed you to know your current status of your health, right? Especially on detecting cancer early, which we know the benefit of it, right? So I think maybe we can continue the question, right? Mr. Hafiz also asked, what about the treatment once detected? Definitely, the treatment will depend on you actually consulting with your clinical oncologist. Once the test actually, example, if positive, please consult your clinical oncologist for further assessment and further consultation.
I would say the treatment is the same. It's just the main thing we are hoping is to diagnose or to detect the cancer at the earliest stage. Let's say, for example, lung cancer. 80 to 90% of the lung cancers diagnosed in Malaysia falls in stage 4 or stage 3. These are late stage, bad stage. Outcome is poor. However, if we are able to detect, let's say, lung cancer at stage 1, then the standard treatment will be surgery, operation, and remove it. Yeah. So the treatment is still the same, but we want to catch it early. The difficulty is catching it early. Yeah.
Yeah, definitely. Yeah, but nowadays, right, if you're not able to present certain cancers, right, cancerous cell would not actually indicating any symptoms. It's asymptomatic till it become detected very late stage, only you have those symptoms.
Yeah.
So this is what is the difference that we can offer with this multi-cancer early detection. You have to catch it early, definitely, right? So I think we can continue with another type of question. What makes ctDNA better than the other types of liquid biopsy? Dr. Ankush?
Wow, I'm very impressed that people have heard of this term liquid biopsy because it's a very, very scientific term. And with that, I think also the audience here is very knowledgeable. So we can go into further details of the test. Probably change the slide, the previous one. Alright, so let me just share with you, because if you have heard of ctDNA test, if you have heard of liquid biopsy, and now that you know about multi-cancer early detection tests, there are tests available other than Gene Solutions as well. But something that we are very proud of is that we have the largest validation study in Asia. So all this validation study of ours had more than 9,000 participants, all from Southeastern Asia. So that's why this database is very much catered to the Southeast Asian population, and it is the Asia's first multi-cancer early detection test. Besides that, we also have our real-world evidence data for cancer screening for these 10 types of cancer, and we have a number of publications that actually back these scientific claims for this test. And these are published in various peer-reviewed journals. So this test comes with a strong scientific background and validation. So I think that's how we differentiate from other ctDNA tests.
Okay, very good answer, Dr. Ankush. I hope Noraini Raza, it actually answered your question. So with that, right, ultimately, I would like to ask one question before our end of the live, right? With you understanding from Dr. Chong on early detection is definitely save life, and Dr. Ankush, what is the science behind this multi-cancer early detection blood test, which is non-invasive? So my question to you is, for the audience, would you be even doing this blood test, which going to save your life? Can we have a polling question, please? Just to let us understand whether this awareness, right, of this FB Live able to actually raise awareness. So I'm sure that many of our friends, families may not be actually hearing this live. If you are actually know that they can benefit, please feel free to actually share with them. And for those already indicating that they're interested to join this, which we have almost like 900 plus audiences, perhaps after this session they can continue to watch the live for them to benefit from this session. So can we have the post question? Is it posted already, the question? Let's see. I think we have not seen the question being posted. Okay. So if those have seen the question, perhaps can we get you to answer that? And perhaps we will actually reveal the answer later on as well. As now it's already 6 o'clock, perhaps we will keep the time. So maybe we can have our last slide. So with that, right, I think definitely we want to actually benefit for those are actually tuning in this Facebook Live. Yes, you definitely, your blood actually hold the life-saving clues for you, which you shouldn't be waiting to actually uncover them. And early detection is always a key to actually help you, your family members, and those you love, right? So you can actually bring them together. So if you are ready to take control of your current health status by doing this multi-cancer early detection, please WhatsApp this line, which is as indicated on the screen, right? And later on, our team will also post that in the comment site, which you can actually refer as well. You can book the test. The test is only 1,755 for you to have early detection of your top 10 cancer, like what Dr. Ankush just mentioned. And please mention FB Live MCED so that we can understand that you are actually getting this awareness from this Facebook Live, hence you wanted to take action to book for your screening today. So this is only the ring bottle which you can actually use it to hold your handphone as a magnetic ring that we only offered to the first 10 sign up with this Facebook Live. So do consider that, and with that, we wanted to thank you everyone for your participation, and please continue to share this Facebook Live to your friends and family. And at the same time, definitely I would like to actually thank Dr. Chong for your time, as well as Dr. Ankush for sharing with us this very information in our Facebook Live today. And we hope to actually see everyone in another time. Thank you very much and goodbye.
Thank you. Bye-bye.
Thank you. Bye-bye.